Point number 3, carbohydrates drive insulin, drive fat. Diabetes and obesity are really two sides of the same coin.
I mean, that couldn't be more true. I mean, if you look at the statistics even from the CDC and look at the epidemic of obesity over the last 20 years, you can see it on the graphs. You can see how much more obese each of the states has become. And very closely following in the footsteps of that obesity epidemic is a diabetes epidemic that just falls right behind. And unfortunately, it's a problem, as we talked about last night, that doesn't just affect America and affluent societies that have access to a lot of processed foods and fast food restaurants, but it's something that has occurred in third world countries, in poor areas of the world, and they're also being affected by this obesity epidemic, which is also producing a diabetes epidemic right behind it. And clearly, as you become more overweight, especially when you develop more abdominal weight gain, you know, the insulin resistance that's a part of that story. I mean, what is diabetes? I mean, it's insulin resistance. And how do we diagnose it? We diagnose diabetes with a glucose. We should be diagnosing diabetes with an insulin-resistant marker of some kind. In my opinion, the NMR lipoprofile is that. So we can see this window into diabetes 10 to 15 years before it's there. And at the time when people are beginning to become overweight and they're beginning to develop this abdominal weight gain, that's when insulin resistance is starting to occur. And that's when we really need to be calling it what it is. And it's essentially diabetes in an early stage. And I think when you say diabetes in a sentence to a patient, they start to pay attention because they don't want to be, you know, they don't want to have the morbidity, mortality that they know diabetes is associated with.